Good evening. I'd like to call to order the school board meeting of March 10th, 2020. I'd like to invite Dr. Camilleri up to the podium for the invocation and pledge, please.
Good evening. I'm Dr. Camilleri. I'm the principal of Seminole County Virtual School, and I'm here to introduce Sarah Washington, one of our wonderful students. And Sarah's been with us for about 3 years at Seminole County Virtual School, and this year she's a senior. She loves to dance and do photography, and currently she's doing community service in our IS department, which is wonderful. And next year, she'll tell you a little bit about it, but she will be going to Full Sail, and she does have a scholarship. And Sarah really is a dream student. Her teachers describe her as a student that they just love to have in her class, and she's had the opportunity to have several teachers 2 or 3 years in a row. And she's self-motivated, she's kind, and she has such a great ability to form relationships with both her peers and her teachers. And I'm going to ask her to say a little bit about herself at this time before she says the pledge.
So hello, my name is Sarah Washington, and I'm pretty sure you heard that I am a senior in Florida Virtual School. So yes, I do have other hobbies, and that includes cinematography, photography, dance, drawing, and all sorts of subjects and stuff. So I really do enjoy working with virtual school because it allowed me to be the student that I am and to allow a lot of flexibility in my time. And that has helped me to be a lot more confident in speaking at different meetings as such, like this one, is really grown my confidence. And yeah, that's just really a little bit about me. And can I have everybody stand for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Sarah.
Is it S-A-R-A? I think so.
Thank you, Sarah. Let the record reflect that all school board members, superintendent, school board attorney, and school board clerk are in attendance today. Would Shelley Pedraza be here? Okay, I was going to introduce her as our new SCCPTA president, so thank you. Dr. Griffin, do you have any modifications for the agenda?
Yes, Madam Chair, I have two. The first is the addendum for good cause is marked on our electronic agenda by a green flag named addendum item. And the second, I'm pulling 2 items. I'm pulling item VW middle school field trip request and VX high school field trip request.
Thank you. School board members, do you have any requests for modifications or questions? Member Calderon?
No, ma'am.
Thank you. Member Sanchez?
No modifications, thank you.
Thank you. Member Kraus?
No.
Vice Chairman Pennock?
No, ma'am.
Thank you, and I do not have any either. Can I get a motion for the approval of the agenda outline, please?
So moved.
Second.
Second, any discussion? All in favor signify by saying aye.
Aye.
Motion passes. Thank you. Dr. Griffin, presentations?
Yes, we have a few.
School board members and Dr. Griffin, I am proud to present to you Mr. Chad Wilski as our March Veteran of the Month. After a semester of college and thinking college was not for him, Chad joined the Air Force in 1990. After his completion of basic military training at Lackland Air Force Base in San Antonio, Texas, Chad attended dental technical training at Shepherd Air Force Base in Wichita Falls, Texas. From there, he was transferred to the 67th Tactical Reconnaissance Wing Medical Group at Bergstrom Air Force Base in Austin, Texas. At Bergstrom Air Force Base, Chad worked with the base's dental oral surgeon and managed the day-to-day operations of the dental surgical unit. Chad served during Operation Desert Shield and Operation Desert Storm. At the conclusion of the Gulf War, and with the encouragement of his colonel and the other officers in his unit, Chad decided to take the opportunity to leave the Air Force after 3 years of service to attend college. During his time of service, he earned several recognitions, awards, and medals for his superior academic achievements and performance. Chad joined the Air Force for a career, and at the time, to surf the best breaks in the world. Well, those things did not necessarily work out to his plan. However, Chad will tell you the people, skills, and life experiences he gained in those short years were instrumental in developing him as a leader. Chad joined the SCPS team in 2000 and is honored to be part of the team who is committed to serving others. He has the privilege of serving and leading our district's Red Apple dining team. Chad and his wife, Pam, have been married for 23 years. They have 2 sons, Samuel and Caleb. Pam is with Samuel tonight at the high school baseball game, and Caleb is here enjoying his first board meeting.
Good evening, school board members and Dr. Griffin. I'm Jean Van Smith, Executive Director of the Foundation for Seminole County Public Schools, and I'm so excited to welcome Addition Financial tonight for a check presentation. Addition is a great partner of Seminole County Public Schools, and one of their programs is their debit card program, which every time their members swipe their debit card, Addition makes a donation to the school district. This year, in 2019, they raised over $15,000 to support the foundation in the school system, which will go to our mentoring programs, college scholarships, career technical education. So we're so excited to welcome Kevin Miller, Katie Thomason, and Katie Bowman tonight.
Thank you. On behalf of Addition Financial, I'd like to thank you for inviting us to present our donation check this evening. We're proud to be a long-standing partner of Seminole County Public Schools. Our roots in education shaped who we are as a credit union for more than 80 years. As you can see, we launched our school debit card program, and to this point, we've donated more than $226,000 to Seminole County Public Schools. In addition, we've partnered where we have 2 high school branches run by high school students serving the community. Also, at the request of Dr. Griffin this year, we've done our part to try to help with affordable housing. And we're launching our A+ mortgage program, where he's asked us to try to help the teachers tackle the affordability issue. This program allows us to bolster our school district ties and help in the school district program. Education remains at the heart of everything that we are as a credit union. We're proud to continue to partner with SCPS, and we thank you for being such great partners of ours.
Board members and Dr. Griffin, I would like to share with you that the Finance Department, for the 19th year in a row, has received a Certificate of Excellence from the Association of School Business Officers for our comprehensive annual financial report that we produce annually. I disappear from my marriage and the rest of my life for about 2 or 3 months. During the production of this, it's much like giving birth. But I couldn't do it without a really strong and dedicated team of people who are on the in the finance department and the budget department. This is quite an accomplishment. It's my first year as director of finance, so this is truly my baby. And I can attest to the fact that I absolutely would not have survived CAFR season without my team. So I would love for my team to stand up so we can applaud them for this award that they deserve.
Donna.
Okay, as the health department is making their way up, this morning I sent an email out to our school administrators, and I see a lot of them here. Please stand up so we can just thank you for taking more time out of your schedule to pick up some information. We know you have lots of places to be. We appreciate you being here. Okay, Madam Chair, board members, it's my pleasure to introduce Donna Walsh and the awesome health department. We have a great relationship with them. They did a very informative presentation to cabinet, but I think it's good for, certainly for all of us to hear, for school administrators, for the audience, just so we know what's going on. And after that, I have a little update from my conference calls with an S today. So Donna, I'll turn it over to you.
Thank you so much, Dr. Griffin. Thank you, Madam Chair, Madam Vice Chair, and board members for inviting us tonight to provide an overview of coronavirus, our preparedness and response. As you all are probably very well familiar by now in watching the news and also, talking to folks in the community, we have been preparing in the United States for the coronavirus coming our way for several months now, working very closely with our community partners, including the Seminole County government, as well as you all, and reaching out to others, such as our long-term care facilities, nursing homes, and folks that we can talk to, faith-based organizations. We've already talked to, just last week, we talked to a group of faith-based organizations to give them a briefing on what's going on. So coronavirus, there's 4 different strains that we're familiar with over the years affecting humans, and one of those very, very well known is the common cold. This particular strain, though, is a new strain. It's something that we experienced in 2003 with SARS, and later, several years later, with MERS-CoV. It's a beta virus. It's a different type of strain that originates primarily from animals, bats in particular. MERS-CoV actually transitioned to camels to humans from bats originally, and our epidemiology manager is going to go into that in more detail here in a few moments. But with this strain, the research, the scientists are still looking into the research on this particular one, but as it stands right now, it appears that it may have originated in bats as well. The epicenter, what we consider the epicenter where the outbreak originated, is in Wuhan, China, and also in Hubei province, which is around Wuhan, China. If you were to reference the World Health Organization, you would see that the majority of cases are occurring there, over 81,000 cases to date. And most of the deaths are occurring in that area as well. Mainland China is affected too. So several weeks ago, probably more like a month or so ago, they did impose, our country did impose actually monitoring those folks who are coming from the most affected areas. So in other words, people traveling from mainland China would be screened through our 11 out of 22 quarantine stations in the United States. In the state of Florida, we have one quarantine station, that's in Miami-Dade, but that one is not one of the 11. And if folks came over to our country who were symptomatic, then they would be quarantined in place. If they were asymptomatic, then they would be allowed to go to their destination. The CDC would contact local health departments to inform them that they are here, and in turn, we would monitor those folks for 14 days. We've had a few here in Seminole County that we've monitored, and the majority of people have made it through the 14 days, uneventful. They're fine. And so we have recently, as of yesterday, have included Iran in that same process now. So folks coming from Iran, because they're starting to see their cases increase, nowhere near what China has experienced since December, but we are starting to see an increase there. Italy and South Korea are also two other countries that we consider are at level 3 travel restrictions. Just the risk there. But Italy and South Korea are not going through the quarantine stations at this point. That may change. Even today, as we were sitting in our meeting, I think we received at least 10 different updates. So this is evolving, as I said, pretty rapidly, and we stay up with all of the recommendations from the Centers for Disease Control and Prevention, that's our guide, as well as through our state that sends down protocols and such for us to follow. So we are watching, as I mentioned, very closely. In Seminole County, only a few people have been tested. There's criteria that the CDC puts forth. As you may have heard again on the news, there's a limited number of test kits available to all of the states nationwide, 75,000 to the Bureau of Public Health Laboratories. In our state, there's 3 Bureau of Public Health Laboratories, Miami, Jacksonville, and Tampa. So there's only been a handful. We follow the criteria very closely. That criteria changed twice today. So, and you'll see that commercial labs have developed the test kits. They're not widely distributed yet, but across the nation you are seeing, as of last Thursday evening, some of the commercial labs are coming forth with those test kits. And all a doctor needs to do is order, if a person has symptoms consistent with coronavirus, which are very similar to the flu, they would order a test for coronavirus. We would be informed as a public health entity. We have an electronic reporting system called Merlin, and those test results come to us through that electronic system. Even our hospital partners, our walk-in clinics like CentraCare, all those reports come through to us. So we in turn can do our investigations and contact tracing and make sure nobody else in the community gets sick. So those who are coming to us from the affected areas, like I mentioned, Iran and China, if they're not ill, we monitor them for 14 days. The incubation period is 2 to 14 days on average. And as they learn more, the scientists and researchers learn more about this disease, that's one thing that's been pretty consistent, that 2 to 14 day period. You'll learn from our epidemiology manager as well, Kevin Baker, that what we're experiencing right now, those who are most vulnerable to complications of this virus are the elderly, and those who have what we call comorbidities or chronic illnesses. That could be heart disease, diabetes, cancer, a suppressed immune system. Those are the ones who we're seeing are developing more complications and even death from this particular virus. But between 80 and 85% of people recover. A lot of folks are asymptomatic or very mildly symptomatic. And in fact, children seem to be faring very well. So, they may get infected with the virus, but they don't seem to be developing the complications as those other populations that I described. So I wanted to introduce to you our team here, and then I'll have Kevin Baker, our epidemiology manager, talk to you more specifically about coronavirus and what we've been doing to prepare and to make sure that we're safe here in Seminole County. So we have Myrna Chamorro. She's our public information officer, and she does everything, marketing and so forth, but she's... Good evening. And then we have Anna Scuteri. She's our Director of Community and Population Health that oversees our epidemiology program and many other things. Kevin Baker, as I mentioned, our epidemiology manager. Many of you are familiar with Gigi Rivadenera. She's our school health program manager, and that's our team. But then you know Stephanie. And so, Kevin, I'm going to turn it over to you here, and you can talk to us more.
Okay, thanks so much for having us here to talk about this. It's an important issue. We want to make sure everyone is well informed on what you can do to prevent the spread of this disease. So we will get started. We're going to talk about the outbreak. We're going to talk about transmission and symptoms, treatment and testing, prevention, the up-to-date travel advisories, and public health monitoring. So on March 1st, the Florida Department of Health did report out our first 2 cases, one in Hillsborough County and one in Manatee County. So as a result, the governor worked with the state surgeon general to declare a public health emergency. So as Donna mentioned, this virus originated in Wuhan, Hubei province, China. And basically what happened is people were coming down with a pneumonia and respiratory illness, and they didn't know what it was. They were doing all the normal testing, nothing was coming back positive. So as good disease detectives and epidemiologists, they're looking to try to find out what caused these people to get sick so we can look further. So they did some digging, and they found out that most of these people were linked to going to a seafood and live animal market in Wuhan, and they were getting exposed to animals that, where they were hypothesizing that they were around animals that had this virus. So as you know, this has spread widely to many other countries. It's starting off into different provinces within China and then to the rest of the world. So as of today's latest numbers from the CDC, we have 647 cases in the United States. We have 14 cases in Florida residents. As we said, this has spread. There's a growing number of locations across the world that's seeing cases, even here within the United States. The numbers are available worldwide through the World Health Organization website. They break down the numbers by the county, and then with some of the, with the countries, and then within China, they break down exactly where they're seeing the cases within each province in China. And then we have noticed the local community-based transmission, so basically where people are getting sick, but they themselves did not have travel to China or to Italy or Iran or South Korea. So we are seeing people getting it with no exposures, and so we are seeing that local spread. So transmission and symptoms. So if there's anything good to say about this virus is that it's not super contagious in terms of that it's airborne. So that me being here, that everyone in this room could be exposed. We say that being within 6 feet of someone that has the virus for a prolonged amount of time, those people are the ones that are at increased risk. And that's because this is transmitted through what we call droplets, respiratory droplets. So those are a little bit more weighted. They can't really travel very far. It would really take a big gust of wind for any of my droplets to come over to you there, so you can consider yourself safe from anything that I might have. So it is really something within relative close contact that we're looking at. So the symptoms we're primarily looking for are fever, cough, shortness of breath, or difficulty breathing. So if someone's not really exhibiting those symptoms, we would not really consider them to likely have the virus. We wouldn't typically test. But as Donna mentioned, there are commercial testing available, so doctors can do more testing, which can then lead to potential cases that we may see that we wouldn't traditionally test at the state lab. So CDC recommends that if anyone is developing symptoms and believe they were exposed in some way to coronavirus, that they should call the health department, which I'm telling you, they have been. We have been getting many phone calls. I have fever and cough, and we have to assess the whole situation and determine if they really had a true exposure. And then we make that determination if they need testing and if they need to isolate themselves. And we go through this at least 10 to 20 of these consults a day, and getting calls from doctors' offices and hospitals and infection control and from the media. And we're all just very busy handling this. So, but this is definitely happening. There's no treatment for the disease. Unfortunately, there is an investigative drug that's used in more severe illness when they see someone that is really sick and hospitalized. But for the average person that has a mild illness, they don't really have anything they're giving them. They're just telling them they need to isolate at home. There you go. Okay. So the testing is available through our state public health laboratories, as Donna mentioned. We have 3. So if they meet certain criteria, we will have the healthcare provider collect specimens, or in the rare event, if we need to collect specimens, we will, and have those sent to our state public health laboratory. Then once those results, if they are positive, those specimens will be sent to the CDC for further confirmation. Just recently, they did have some commercial testing available, so now, as I said, doctors can order that through commercial labs. And then basically what happens is that this is a reportable disease, so there are Florida statutes and Florida administrative code that require healthcare providers, laboratories, and hospitals to report these cases to us. So they should be consulting with us even if they're deciding to test through a commercial laboratory. That way we can initiate the appropriate control measures to prevent that person from potentially spreading this to others. So people that have traveled within the last 14 days, particularly to China and Iran, as Donna mentioned, those individuals are actively monitored by public health. So when they come back and they make it to their final destination, if they're asymptomatic, we do follow them for 14 days just to ensure they don't develop symptoms. If they do develop symptoms, we coordinate care, so we just don't blindly send them, just go to your doctor or go to a hospital. We make sure we find out where they're going. We contact the facility, let them know they're coming so they can take the appropriate precautions to prevent any further exposures within the healthcare facility. And the important thing to remember is that the risk can change over time. It's kind of like our brand message now is rapidly evolving, so you're going to hear that word, that phrase very often, because as Donna said, this is constantly changing. Within hours, we could have updates that supersede things that we say during this presentation. So it makes it very challenging, but we try to keep as up to date with that latest guidance as possible. Let's see, so as we kind of talked about, hopefully you all have heard these messages. They're not new messages. If you have respiratory illness, stay home. Try to wash your hands as often as possible. A lot of viruses and bacteria live on surfaces, so if you're touching those doorknobs and touching chairs and touching light switches that 100 other people have touched, then you're likely to get those germs on your hands. So adequate hand washing with soap and warm water for 20 seconds is really the most cost-effective way at preventing spread of disease. And then making sure you don't touch your eyes, nose, and mouth, of course, after touching surfaces. So I know that's very difficult. It's kind of second nature to wipe your eye or wipe your nose, but it's just you have to kind of train yourself and focus on that, because in this type of situation, it's very important. Also, another really important measure is to make sure you cover your cough. So we know back in the day we were coughing into our hands, and hopefully now we're coughing into our elbows now. We get good coverage that way, and then that prevents you from then getting it on your hands and touching surfaces and spreading whatever disease you might have, if you were to ever have the flu or something like that. And of course, we're telling people if you're sick, do not travel. We don't want you, going on airplanes and going to other countries and then sharing what, we have here in the U.S. to other countries. So we just want people to stay home, wash your hands, cover your cough, and wait until you feel better before you go out in the public. So we kind of talked about this, washing hands with soap and warm water, using hand sanitizer that has at least 60% alcohol, avoid touching the eyes, nose, and mouth, and avoiding close contact with those that are sick, and stay home when you're sick. So the travel advisories that we have, it's really important for travelers who are sick to try to delay or somehow reschedule their travel. A lot of the airports have been sending out emails saying that they'll allow people to reschedule their flights. I can't speak for every airport because I'm not with them, but it is important that people look into those opportunities. Again, that way we can try to prevent any further spread or exposure to this disease. So we talked about staying outside of that 6 feet area from people you don't know. I know that sometimes that's not the easiest, but trying to keep as aware of that as possible. That's the best way. That way you're outside of someone's range of their droplets. And then another really important thing, we see a lot of people stealing all the masks out and buying all the masks and buying all the toilet paper and buying all the water bottles, and everything is gone like we're in a hurricane situation. And so really we're trying to explain to everyone that right now, especially with the masks, the ones that we see people wear on a day-to-day, those masks are designed to help keep what you have in you away from other people. It's not good about keeping things from other people from getting to you. There are special, what we call respirators, that are used more so in healthcare facilities that protect healthcare workers from getting exposed to respiratory secretions from an ill patient. Those are not widely available. Those are usually available in more healthcare manufacturers, and so you'll see people going out and buying those masks, but unfortunately that's not what's going to keep you safe from this. It's the measures we discussed earlier. So as of today, we still have the 5 countries with at least a travel 2 advisory. So at a travel 3 advisory, we have China and Iran. So those are considered to have the widespread community transmission, but they also have a restriction on travel into the U.S., meaning what Donna said about they're all going to those 11 quarantine stations and have to be monitored. South Korea and Italy are also a level 3. They have a travel advisory again, but the difference is there's no restriction. So while there's widespread transmission in those countries, we are not actively monitoring them as we are with China and Iran. And then Japan is a level 2 travel advisory. So with that, it's just self-monitoring. Same with South Korea and Italy. You're just monitoring for symptoms for those 14 days. If you develop symptoms, isolate at home immediately and call your local county health department or healthcare provider to try to coordinate care from that point. So this is something that CDC developed toward the very, very beginning of this when they initially put the restrictions on people traveling from China. This was given, this is also in Mandarin as well. So they're given this card if they're asymptomatic. This basically says what the situation is. There is an outbreak going on in China, and they want to make sure that you stay home whenever you get to your final destination. And then you'll see at the bottom right, there's a section for triage for staff and clinicians, and they can, if they maybe don't speak English and they have the Mandarin form, they can give that to the healthcare provider, and it tells them, this is what's going on, and then they can assess and triage them appropriately, again, to prevent those exposures. But it's kind of like one side is English, one side's Mandarin, so the healthcare providers don't have to translate the Mandarin, so. Yeah, there we go. Okay, so this is my baby, public health monitoring. So this is what my program is really focused on. This is the major public health response. So across the 67 counties, every county is doing this public health monitoring if anyone is coming in from China and now Iran. So we're receiving people almost on a daily basis from the CDC Division of Global Migration and Quarantine. They are sending us people that are coming in from those countries, or also lately, now that we've been seeing cases on cruise ships, if they have a lab confirmed case, they're getting those manifests and sending those to us as well in the event we do need to monitor people that may have been exposed on cruise lines. So we're really just working to talk with them about restricting their movement. So, if you don't need to leave home, don't leave home. If you can coordinate having someone get your groceries and taking care of the kids and taking care of your family and your pets and so on and so forth, you want to try to do that. And then even when you're at home, if you're not ill, you want to stay away from people, because what we really don't know about the virus is how easily you can still spread it in those 1 to 2 days before symptoms start, because we do know that there are some viruses out there that can do that. So we just say to try to keep as far away from people, even within your own household, even if you're not sick, until that 14-day period has passed. Okay. All right, so we kind of talked about this already, but we're monitoring for 14 days. They're going to self-isolate for 14 days, not using any kind of public transportation because that is not 6 feet away. So you're trying to stay away from large gatherings, things like that, where you could be in close contact with other people, especially those you don't know, because then that's how we have the unknown spread and we can't find out where that person may have necessarily got it from. So we just want everyone to stay home for that 14-day period. I'm coming from those 4 countries, or from those 2 countries technically. Even I want to make it clear though that while we have the active monitoring for those coming back from China and Iran, we're still recommending that people traveling from Italy and South Korea that they do stay home and monitor themselves for symptoms. So as we're here today talking about school, we're trying to make sure that people, again, that they're staying home from school and work. That is something that we are pushing forward, even though education is certainly very important. And work is very important. We do, again, want to prevent any kind of outbreaks from happening in the school setting. In terms of pets at home, we talk about wearing a mask around other people as well as animals because, again, since this is a new disease and we do know this can come from animals, we don't really quite know the extent to which this can be transmitted from humans to animals. So trying to keep that distance is super important. So the important thing to remember is that at this time, the immediate risk to Americans remains low. Right now, we do not have any known cases or reported cases in Seminole County. We do have some, of course, in the state, so we're staying very active on our monitoring and surveillance. That way, if there does happen to be a case in Seminole County, that we can respond quickly and implement those measures to prevent any spread. As we mentioned earlier, this is person to person, so that's pretty much the way people are getting it. It's not people are going to animal markets here in the United States or anything. It is, people exposed to others that have the virus. So there are 2 websites I'm going to show you. The first is the Florida Department of Health COVID-19 website. So this is kept up to date with lots of information. You'll see in your packet here, I've put a lot of information from the Florida Department of Health website and from the Centers for Disease Control website. So there's lots of information. I didn't print out all of it because it is a wealth of information, but you'll see various fact sheets. You're going to see information on interim guidance for administrators for child care programs in K through 12 schools. You're going to see information on environmental cleaning and disinfection because we get lots of questions from the schools about that and how do we clean for this particular virus. We also have information on talking with children about this disease and help them understand what's going on. There's also some additional guidance just for the, every day, just making sure that you practice good hand hygiene, things of that nature. So that's in here as well as some flyers on hand hygiene, how to wash your hands for kids, and that way you can go over that with them. And there's a wide number of flyers that we have on the Department of Health and CDC's website that can be printed and mass sent out through the schools. And that is all. So thank you so much.
So Stephanie and Gigi, I'm going to turn it over to you.
So I would like to, good evening, first of all. I would like to share with you some of the updates, some of the things that we have been doing to help keep the community informed, to help keep our students safe at schools as well. First of all, we've created a web page for updates, or specifically for the coronavirus, for updates and where to go to get the most up-to-date information, since the information is changing very rapidly. So we want to, even though we're sharing some information, I may not keep up as quickly as the information is being shared, and direct the family members to that webpage to be able to get the most current information. We have sent out communications as well, like I said, via email, some phone blasts as well, to make sure that the families are informed, and the staff members as well. We've gotten lots of questions from both family and staff, principals, and students as well. Communications between Seminole County Public Schools and the Health Department. They inform me as things come in, and I inform them as I'm getting questions or concerns about family members that are traveling back into the county or traveling out, and how we should take care of those situations. We have implemented for the buses to be disinfected in the evening times daily now, so that we can help to prevent any spread, any transmission from the students who may be riding the buses, just as a good habit, not necessarily for coronavirus, but just a good habit for us to start with. Our medically fragile classrooms, we've also implemented an extra daily wipe as well, so during the day as well as after school, so that those students who are immunocompromised in our classrooms, they can also have that extra added layer of protection of having those items cleaned again throughout the day. The staff have also in those classrooms been asked to wipe down as they're using the toys or whatever items or objects that the students are using throughout the day to wipe in between students. We've increased supplies through our school store, thanks to the foundation. They have increased hand sanitizer, wipes, and tissues, desk wipes, I should say, for the staff to be able to, or the principals, to be able to get that, those items and supply it to those teachers in the classrooms. We've worked on, or working on installing more dispensers for the hand sanitizers. We've also noticed that some of the hand sanitizing dispensers that we have now are not for alcohol-based solutions, so we're making those adjustments so that we make sure we have the alcohol-based hand sanitizers. Been answering lots of questions from families, like I stated. We've sent out some videos after some of those questions came in so that we can make sure that the students are getting some information. Dr. Dillinger found an awesome video for the students to view, and it gives them a great breakdown of what that virus is. I have a few students, family members in the county, and they all came home talking about it after they viewed it, so I know that they're definitely listening. We've also sent out a video, or had them watch a video on hand washing as well. Healthy Hands, one of our volunteer programs. They've been beefing up on the amount of volunteers to help teach that, implement that. We have a couple of schools that have asked or requested for them to come out, and some of the nurses are working with them to be able to implement those education programs there in the classrooms over the next couple of weeks. Updates as far as what we've been doing to help keep them more safe.
Thank you. Board members, questions?
I do have one question on the communication. Are we sending it out in multiple languages? I've had a couple questions just while sitting here from families that speak Spanish that aren't getting.
We do have a team member that has been translating the communications that I've been sending out.
Everything that's come out of my office to Stephanie Jackson has been translated by Ms. Cardona's team. So let me know if somebody did not receive something, because we've been making sure it's all available in 2 languages.
Okay.
Member Sanchez?
Thank you so much for such a thorough report. I have a couple quick questions. Does it show up in blood work? Out of curiosity, I'm just wondering, like, is your white count elevated like it would be necessarily with the flu?
The white count would be a good question. I know that they can detect antibody in blood tests, but that's not the preferred test.
Okay.
Because when you have active disease, they do ask that you get an oropharyngeal, nasopharyngeal swab. And if somebody is coughing, you can get sputum, a sputum sample. They don't suggest that we induce a cough, because that would make it more likely to spread to the healthcare worker. But to answer your question, you can detect it in blood. It's just not the preferred test.
Thank you.
I don't know about the white blood cells. I would imagine if you're sick, you
Right.
most likely would see that.
How long does it take for the test to come back from once somebody shows its symptoms?
With our state laboratory right now, they're averaging around 4 or 5 days. The commercial laboratories, as the test becomes more available, they're telling us that might be a shorter time frame, down to a couple days. But right now, it's averaging about 4 to 5 days.
And then the last question, knowing that a possibility from like maybe brown bats or things like that, I happen to see some people dogs wearing masks. No, I'm not sure why, and just want clarification. I mean, I know this is serious, but at the same time, I'm hoping we're taking the same measures that we're doing now for the flu season as well.
I mean, we have not seen any recommendations to put masks on animals at this point, honestly.
Right.
Now, that doesn't mean that tomorrow they may not come up.
And of
but-
course, human beings are way more important than an animal, so.
But even for the human beings, I do want to, I'm glad you brought that up. We have some school staff that have been wearing masks that are not sick, but the recommendation is for the mask for the staff or the students who are sick. Staff can easily go home. It's for our students who are sitting in the clinic, who, we're waiting for the parents to come and pick them up. We would like for them to wear a mask since there's not that much space in the clinic to isolate them from other students who may be in there.
Okay, thank you. And also, the mask, the N95 respirator mask for people that test positive, is that the mask that is recommended for them, or is it something different that they wear?
As Kevin was mentioning.
It's not, okay,
No.
because I couldn't
So-
understand that part.
So for folks who
Thank
are
you.
sick, they should wear what we call a surgical mask, and that's just to
Surgical.
keep the respiratory droplets from getting out and
So
spreading.
no other mask
The
is-
respirators are for your healthcare workers to keep the organism from getting in, so.
Okay,
Yeah,
thank
if
you
you
for
were to
that.
put a respirator on somebody who's sick and having difficulty breathing, they're
You
not going
can't
to be
breathe
able
out
to
of it.
breathe. No.
Exactly,
So-
because that's what I heard, it was horrible, that you can't breathe out of it. So all these people that bought all this and
And then your
basically-
respirators are supposed to be fit tested so that, you make sure you have a secure seal and the organism can't get through. So for folks, you can buy a respirator from Home Depot. Folks who paint and whatnot, they're advised to wear respirators. So you can get an N95 mask from Home Depot, but it's not a medical mask and it hasn't been properly fit tested.
Perfect. Thank you so much.
Thank you for your presentation and your time tonight.
I just have one quick
Member Kraus,
question.
please.
And for Stephanie,
Okay.
is that okay? You talked about the extra cleaning that we're doing in our schools, right? Does that include like light switches?
Yes.
Armchairs and?
Yes, so all of the high touch point areas, so doorknobs, light switches, the sink knobs, including the computer keyboards, yes, telephones.
And what type of cleaner are we using?
So we had two cleaners that we normally use, which those products are approved or appropriate for cleaning this. There's a lot of household products are actually appropriate for the use of cleaning for this for this coronavirus.
Okay, and at home, can I ask, is Lysol the best thing or no?
Any of your normal household cleaning products are at this point, because it's still a new evolving virus. So right now, they're saying anything that would kill flu-like viruses would still be appropriate for this virus as well.
Thank you. Member Sanchez?
Sorry, one more question about thermometers. Do you recommend oral thermometers, ear thermometers? I know that so many doctors are so different about that. And if somebody's taking a temperature at home for their loved one, which one would you suggest?
I don't know that there's any one preferred over another, but if you were looking at infection control, you would most likely want to use something that doesn't involve sputum, right? So the forehead, the ear,
Okay.
that's just from an infection control standpoint. But with one versus another, I haven't seen anything that there's preferences on one or
Yeah.
another.
All right, thank you.
The most
Thank you.
affordable one.
Most affordable.
I said the most affordable one.
True.
Thank you very much.
Thank you very
Dr.
much.
Griffin?
Yeah, board members, I want to give a quick update through phone calls today. I crossed everything off the list that you covered, so it's a very short list. Board members, as you are aware, we were strongly recommended today by the commissioner to cancel all field trips by air, and we followed that, and that will be through the end of the school year. We also were reminded that if we have students or parents that have flu-like symptoms, only if they have been exposed by one of the level 2 or 3 countries or by somebody else should they go to the health department. Otherwise, just treat it like flu-like symptoms and go to their doctor if they have not been exposed, because a lot of families don't need to go, and they are going. Florida Virtual School is drastically ramping up the capacity. Probably over 300,000 students additionally could be served. They're waiting for, they ordered some additional servers. When they get here, they'll have additional capacity if we need to move to a more virtual format. And we have a couple of folks here who I would like to just give some updates to things that we are doing. Now, Health Department, I don't want to hold you up, so you don't have to sit for this, but it's up to you. We'll start with Dr. Gardharold, just a quick overview of an instructional plan in case we have to close the school, being proactive.
So the way we view this plan, good evening, by the way. The way we view this plan is really about in any event that we might have to close a single school. So if there was a water main break and now we've got a school that can't open, at least now we have some sort of a plan that can keep kids engaged while they are at home. And so what we've done is we've created very quickly a repository for all of our students. This is a K-12 initiative. I will say that most of our information that we're going to share tonight is for elementary, because when we think about how our teachers interact with our students, at the secondary level, oftentimes they'll have an eCampus course where they're already interacting with students, putting all of their resources, having conversations, and so that's a much more natural place to interact. And so you'll even see here on the elementary example, that bottom purple line says, don't forget to use any resources that your teacher gave you. So if I was looking at this K2 section here, and I would click on that, it's going to open up, and we are in the process of developing, and we're pretty far along, a 10-day plan by grade level. And so it's never going to be a substitute for the amazing teachers we have in our classrooms, but it's something to keep our students engaged. And if a family is together for 14 days in their home, they might like something for their child to do that would keep them occupied. So if I click on that day 1 for grades K through 2, the first thing that they're going to see is don't forget to do your iReady minutes. iReady is completely online, and so there's no reason that the kids can't do their iReady minutes. We don't want them to go overboard and do 45 minutes a day, but if they want to do 15 minutes, that's absolutely fine. And then we're working on the iReady games, getting those ready to go. So we also have after the kids do their iReady minutes, they can work on reading and writing, and so we start with a journaling activity. We want the kids to be able to journal, and that would be an offline option for students. And so in many of these things, we have an online and an offline option, depending on students' availability of internet access. And so as we go through, I'll kind of point out how we would do these things online and offline. So you can see there then, we also, after the students journal, we have some of the Tumble books, which is a resource that this board supports annually. And those are at-level books that students have online. They can either read it to themselves or they can have it read aloud, and then there's a little quiz that goes along after the text. So those 3 for that particular day are all related to animals. So then we have an informational text selection also related to animals. After reading and writing, then the kids have some other opportunities to engage with some of the activities. So we have Nearpod, another program that this board supports. And so we have a kindergarten, first grade, second grade Nearpod that the kids can access. And so, for example, the first grade Nearpod is related to fairy tales. The students can read some of the fairy tales. There's a place where they can draw. There's a place where they can answer questions. And then there's a quiz at the end where they can share what they know. We have sight words, and these will also come in print version. So there are sight words that would go through as a slide deck so that the students can work on their sight words by grade level to make sure that they're maintaining those skills in the time that they are away from the building. After they finish all of that, then we move on to the math section. And again, we have Nearpod for the students, as well as their iReady. So for example, this kindergarten Nearpod unit might be on identifying patterns, so the students have the opportunity to create patterns, identify patterns, they can draw within Nearpod, and then teachers, when the students return, can access those student results so that we can see how those students did on those activities. The second grade Nearpod activity is called Veggie Stand, and the kids are running a vegetable stand, and they are figuring out cost and making change of vegetables at their veggie stand, and so it's kind of an interactive little scenario-based opportunity for the students. And then again, we have those math facts for the students to stay up on their addition, subtraction, multiplication, division, because those are things that we always want them working on. We want to make sure that those are well memorized. And then finally, we have what may be what I'm calling kind of the family sanity component. So this is really those wellness activities. If you think about car games, if you ever took your family on a long trip, you have those car games. And these are just those types of things that families can engage in that might get everyone in a different mindset and having something else to work on. And so those are kind of the elementary components. And then for secondary, we have a similar site, but a little more of a secondary feel. And you can see here it even says, be sure to prioritize what your teachers are giving you. And within the secondary, we will have then additional resources for ELA, math, science, social studies, as well as those leadership skills and wellness skills so that the students can access all of these materials from home. And the other nice part about where we're building all of this, we're building it in Google Classroom. And so if for some reason staff is not able to be on site, they can work on all of this at home, and we can continue to add resources from wherever we are, depending on what the need is. So we're working feverishly to make sure that this is ready to go. I will say we received information from a very large district in South Florida that their plan is that they are going to give the kids 45 minutes of iReady for reading and math each week, and that is the extent. And so we are really excited that we have opportunities for our kids to get engaged in meaningful learning.
Very cool, very well done. Thank you.
Very quickly. And we'll finish up with Kim Dove and Chad Wilski. Just wrap up cleanliness.
Good evening, board members and Dr. Griffin. It was good to hear the presentation again from the health department, and it kind of validates a lot that we're doing both within the classroom as well as within the school bus. And I'm going to turn it over to Kim Dove right now to give you a little bit of an overview along with the example.
Good evening, board members and Dr. Griffin. How's everybody doing tonight? Uh-oh. Next. Got it. Okay, so what we are doing, our response at facility services. Oh, you can't hear me? Hi. So facility services and custodial is conducting disinfection of all touch points on a daily basis. And just to give you some information on what a touch point is, if you think about anything that your hands touch is a touch point. So in the classroom, tables, chairs, computers, keyboards, light switches, doorknobs, handles, all those things are touch points. So in our custodial handbook, custodians that are at the school do touch points every day, but we are making sure that our district custodial staff are educating the school custodians and making sure that they're doing them properly. And a really important piece of this is dwell time or contact time. So the disinfectants that we're currently using, we're using Avastat D and NCL number 9. Avastat D has a quicker kill time for most viruses that we see. So we're doing 2 minutes with the Avastat D, which is overkill. And that is really effective. So we're doing that every single day. In addition, we have 9 medically sensitive classrooms throughout the district. So we are supporting, we've provided additional staff to make sure that those classrooms are getting done in the evenings in addition to getting done during the day. So as you probably know, it's very difficult to get hand sanitizer right now. So after I'm done with the short little update, we're gonna raffle this off. No, I'm kidding. I'm kidding. So the little apple that we have up there, my team and facilities, we are fabricating 100 of these. So with the sanitizer, because there's a shortage, what we're gonna do is, and the reason that the front of it's scratched up a little bit is because we had to improvise and we created these little containers, because right now the only alcohol-based 60% or more that we're able to get is this advanced Purell, and it's 70%, by the way. But we're gonna go ahead and put those in the apples, and we'll deploy those apples as we need them. But the most effective means is properly washing your hands, like Donna said, for 20 seconds. No, where's the bus? Let me go back. So with the bus, Julie and her team actually put together sorry about that. They put together 16 teams of transportation staff. And what we've done is we developed a protocol, and with that protocol, at the end of the day, so when all those buses come back, we have like 450 buses, right, Joe? So not all those buses are running all the time, but the majority of them are. So every single bus, these are the items on the bus that we are disinfecting. So seats, seat belts, handles, rails, the window latches, door latches, steering columns, all of that is getting disinfected. In addition, we've provided Lysol wipes to transportation, and all of the bus drivers have a container of Lysol wipes in their personal area, and when the students are off the bus, they're wiping everything down. So we're doing everything that we can to make sure that we're disinfecting all those areas and touch points that everybody's coming in contact with. So as Donna said, the most
effective way is washing your hands, but you want to avoid touching your eyes, nose, and mouth. And if you just do a little study for a moment, just for 2 minutes, look at how many times you touch your face. You do it so many times. So when you're doing that, instead of touching your face, think about washing your hands or using sanitizer if you have any. And that is all that I have. If anybody has any questions for me, I'm happy to answer them.
Board members, any questions? Thank you. Thank you, Kim.
You're welcome.
Our veteran of the month.
Good evening, Chair Almond and board members, Dr. Griffin. And thank you again for this evening, and to all our SCPS veterans and those currently serving. What we're doing at Red Apple Dining is really, it's what we do every day. So I just kind of want to share what we're doing on an everyday basis to keep our guests safe. And for most of our parents may not realize that our campus restaurants have full commercial kitchens in them. We are routinely inspected by our partners at the health department on a routine basis. We follow all health code requirements as well. And one of the big things that we hear over and over, and there's a reason for hand washing. So in our business, hand washing is paramount to what we do. So hand washing for us is a operational standard. So when it comes to new employee orientation, hand washing. Hand washing is one of those standards we repeat ongoing throughout the year. We have hand washing training in Spanish and in English, and we have signage at our hand stations as well. Again, hand washing is so important. Something that is very unique to Seminole County and to what we do that may not be found in most districts is all of our managers and assistant managers, each of our campus restaurants, have earned a National Restaurant Association Serve Safe Food Protection Manager certification. So we go through a test, and it's not just our leadership at the campuses. Most of our support team, even myself, go through the certification process as well. Again, just ensuring food safety to our guests. When it comes to, we utilize gloves. When it comes to ready-to-eat food, that means food that's going to be directly consumed by our guests. We aren't using just natural hands touching. Everything is glove, and of course, you wash your hands before you put gloves on. You take gloves off, you wash your hands again. Hand washing. Equipment and tables, again, they're cleaned, and we use a sanitizer. They're sanitized. Temperatures of all foods, hot and cold, are taken throughout meal services and recorded. So we have logs every day of all of our food items and those temps that we keep on our items. Walk-in coolers and freezers, we electronically monitor those on a daily basis too. All that is logged as well. And then we also just regular preventative maintenance on our hot and cold equipment, and ensuring that they are at the right standard as well. So these are just things that we do on a day-to-day basis to ensure the safety of our guests.
Thank you, Chad, very much. Questions, board members? Thank you.
Thank you all.
Okay, we have 3 folks that would like to speak.
Thank you, Health Department.
So if you'll come up and line up on the wall, please.
Thank you
Ann
so
Curris,
much.
Bruce Washington,
Thank you.
and Dan
Thank you
Smith.
so much.
Vice Chairman?
Stay healthy.
The public input segment of the meeting is provided for the purpose of permitting persons to present specific matters to the board for its consideration and action or referral to the superintendent and his staff. The public input segment of this meeting is not open to presentation of campus issues by political candidates, matters involving student disciplinary action, pending employee disciplinary matters, or pending litigation. Each individual member of the public is limited to 3 minutes. A designated group representative may have up to 6 minutes.
Thank you. Ms. Curris, please identify yourself at the mic.
Good evening.
Good evening.
Dr. Griffin and board members. My name is Anna Curris, and I am a partnership specialist for the United States Census Bureau here in Central Florida. As we know, the decennial census happens every 10 years, and the count of the population determines the representation of every state in Congress and the allocation of $675 billion per year for the next decade. Now, there are two programs that are essential in bringing that awareness. One is the Complete Count Committees, and Seminole County has a Complete Count Committee, which is led by Phil Capro. And the other program is Census in the Schools. Now, we want to thank Dr. Griffin for his support and participation, and we've been giving him links to different activities and census facts that the schools can use in the morning announcements, as well as in the marquees, to bring awareness of the census and the importance of responding. So we thank you for your active participation. The schools' principals are engaging their students and staff and families through sport events, pep rallies, and census activities in the curriculum. The invitation letter to respond to the census will start being delivered on Thursday, March 12th. Now, the letters will have a URL and a code ID for everyone to go online and respond to their census questionnaire. That is the primary method that we are encouraging everyone to respond. They can also call over the phone if they wish. I have a different, should I give them to them? Thank you. I have included on your packets some activity books that we are encouraging the schools to use, because obviously the students are the biggest messengers of the census to their parents. And we have many areas in Seminole County with what we call the low response, which means that historically will most likely not respond to the census, and those areas are most likely be the ones that need the funding for the next 10 years. So we have one chance to make a difference in our communities and to shape our futures, and it's happening now. We will encourage everyone to respond as soon as they receive that invitation letter, but they can continue to do so, and we will be reminding them to respond to that census up to 4 times. On the 4th time, we will knock on the doors. So the more that you continue to work with the principals, making those students understand the importance and bringing that awareness to the families, we will continue to see Seminole County thrive in the next 10 years. So thank you again, Dr. Griffin, for your participation. Thank you.
Thank you very much. Bruce Washington?
Good afternoon, Chairman, board members, and Dr. Griffin. I come to you as a taxpayer, a proud parent, as you saw my daughter, and also as an employee, and also as Vice President of NIPSCO. I've been with the system, with the school system, coming up June. I'll complete my 34th year. And I love my job. I love working with Seminole County schools. And I go, and I'm in distribution. I deliver all the supplies, hand sanitizers, all that to the schools. And I get in contact with a lot of the employees, not just non-instructionals. Teachers know me, different ones, even some administrators talk to me. And what I get out there is the morale is so down because they feel that they're not being heard. An instance is that a lot of the maintenance workers, they came to me, they went to Human Resources, they had a meeting with them, but they have never got back with them. They just feel like that no one care about them with their issues. And also going to the schools, your SAMs, some of the SAMs do not know how to talk to the employees. A lot of them I go to, they'd be in tears sometimes and saying, I need my job, but I can't take, the way that they're talking to me like I'm a little child or something like that. And that's not the way we're supposed to be a family. And so, like I say, I go to schools every 5 days a week. Sometimes I go to 7 schools a day, 6 schools a day, and it starts from up top. That's why I came to the board members, so that you can address it. So that, like I said, not just non-instructionals, teachers, and that they come to me. They know I've been in the system a long time, and the reason why they don't come forth, they don't want to get whatever you call it, get in trouble with their bosses or stuff like that, so they come to me. And I said, well, I'll go and say something that, like I said, I've been here 34 years, I've seen it happen before, and we addressed it. And it's like we need, if we're a family, if we're here for the students, and that's why I say I'm a proud parent of my daughter, if we're here for the students, we need to work together. Not, administrators, some administrators come in from wherever they come from, they don't know how to treat, they don't know how to talk to them, they may not know how to manage people, but they may know how to manage their office. And that's what I'm getting from a lot of the employees, that some of them already have quit. They said they just can't take it anymore, and they just don't want the repercussion if they complain, so that's why they come to me. I'm hoping that with me, I'm going to stay here until I see a difference. You're going to see me at board members and board meetings until I see a difference. Because, like I said, when I came 34 years ago, I didn't come here as a job. I came for a career. And that's what a lot of them come here for, not just to say I have a job. They want to make a difference in the student's life. And like I said, I'm a proud parent. You can see with my daughter, a student, and I know other parents want to push their students, and we're number one in the area as a school district. And some of them feel that we're number one. We should treat the employees like we're number one as a family.
Thank you, Mr. Washington. Dan Smith, please.
Good evening. My name is Dan Smith. I am a Seminole County teacher, employee of the Seminole County Public School System. And, well, I no longer live in Seminole County, but I don't know my address off the top of my head. I would like to speak about the coronavirus. First, I appreciate the information that's been communicated from this group here. Although, if possible, I would ask to be included on that as an employee, but as the president of the association. I'm getting them forwarded to me, but I'm not getting the information from the county. So if I could, I'd appreciate it. Over the past week, I fielded a lot of calls from teachers regarding the county's plan as information comes forward. A lot of the questions have been answered, because I will say the communications and the information that has been given out has answered them very shortly after, before I'd even have an opportunity to ask some of these. I'm not anticipating a dialogue, but some of the things I come up will come off as questions, but just not requesting an answer, but just to consider them in the future to get back with those. Some of the questions that have come through here have, for instance, stated, if there is a plan ultimately to close the schools, is there a plan for the makeup days? Additionally, if the schools are closed, we have a lot of students who are on free and reduced lunch. Is there a plan in place to get food to these kids if that were to happen? I apologize. I know it's a loaded question. If that is the case, you need people. I will tell you the Seminole Education Association will gladly help distribute or anything if that were to come up or something. Is there a plan at this moment that if someone is ill and continues to go to work, are the employees expected to report the person? Is there a situation where the absences would be so great that we would need to close a school? Additionally, from what I can read with the Florida Statute 101263 regarding illnesses in the line of duty, I'm curious, and the teachers are, if a employee was infected while going to work, would that be considered an illness in the line of duty? Additionally, the statute does state that there's a limit of 10 days per year that they would be allowed to be paid if they were to get something on the illness, unless the board deems the situation to be proper and warrant beyond that. And I'm asking, please, if this situation is, I'm asking the board, please, to warrant that to be considered an extension for the illness in the line of duty. Also, it goes without saying, but I'll say it anyway, I would ask that confidentiality be respected in situations of health if this were to come. I don't have anything to compare it to, but I know years and years ago when I worked with elementary school, my kids were younger. If there was ever a head lice situation, I know the parents were almost demanding to know where they got it from. Now, I've never seen a situation where the school board or the school has stated that, but I have a feeling we would anticipate the same type of thing. I would also request that the classroom doors be allowed to be wedged open during this time to limit the amount of times that people have to touch the doors going in and out. I understand why the doors have to be closed, but I'm just asking for consideration in that particular case. As I said, we have a considerable population of students who can't afford adequate health care, and many of these students also are relying on their meals. And just please consider that accommodation to get the food to them if necessary. And finally, if we have family members who may have difficulty proving their immigration status, I'm not asking for any violation of the statute, but if possible, could the county respect the confidentiality of somebody who can't prove their legal status of immigration at the time, or possibly provide sanctuary in those cases? Thank you for the communication that you've put out so far, and anything we can do to help, we'll be more than happy to. Thank you very much.
Thank you very much. Appreciate your comments. Okay, that concludes public comment. Dr. Griffin, do you have a recommendation for the consent agenda?
I do. My recommendation is that the consent agenda be approved as presented.
So moved. And approved?
Second.
Second. Any discussion? All in favor signify by saying aye.
Aye.
Motion carries. Thank you. I see no unfinished business, and I don't believe we have any new business, Dr. Griffin?
I do have a recommendation for discipline.
Okay.
The School Board of Seminole County approved.
Apologize.
The School Board of Seminole County approved the student disciplinary recommendations from February 18th, 2020 and February 24th, 2020.
Thank you. Is there a motion to approve?
So moved.
Second. Any discussion? All in favor signify by saying aye.
Aye.
Motion carries. Thank you. We have a superintendent's report.
They are read-only items.
Thank you very much. Board members, do you have anything to share? Member Calderon?
None of my boards that I represent this board on met, but I just wanted to give a few compliments to our phenomenal team. Boyd and your team for the teacher job fair this Saturday was phenomenal, well organized, and excited to offer over 100 positions to grow our family here in Seminole County Public Schools. Thank you to the Unbreakable Foundation for their classroom makeover that they did at Lake Mary High School was beautiful, and our students will enjoy that for years to come. Shout out to Dawn Bonce and your team, and thank you for the sponsorship from Central Florida Regional Hospital and Oviedo Medical Center for the phenomenal Walt Walk. Thousands of our family members were out there staying healthy, loved it. With that, I'll turn it back to you, Madam Chair.
Thank you very much. Member Sanchez.
Kudos to you all, too. Excuse me. I had my Central Florida Public School Board Coalition meeting on Monday, and we had Channel 13 there as well. And we just basically discussed all the different bills that are in our legislative session right now, and it looks like, of course, that we're going to be extending the session. We have a lot of sister bills to each of the House and Senate bills, and a lot of unanswered questions still. But I would suggest that if anybody's listening or watching, to please contact your legislators, as well as stay informed with what's going on. We're not sure about a lot of the different bills and what's happening with them right now. Hopefully they will be decisive soon, and we can get what we need to run our schools the proper way. And then I had the Value Adjustment Board orientation meeting with the County Service Department, and those are the two meetings I had. And once again, kudos to our fabulous executive cabinet and our wonderful employees for everything that they do day in and day out.
Member Krause?
I had only one meeting so far this month, and that was the Business Advisory Board, and Dr. Griffin was the presenter. He was very well received. We have a great partnership with our business community, and we're grateful for their work, too.
Thank you very much. Vice Chairman Pinnock?
I had one meeting with our SCPS Foundation, just one update. Jean will be providing all of us with an idea list of how we can help support the foundation with ideas from supporting events through bringing board members, new sponsors, new ideas to the the foundation to help to support SCPS.
Great, thank you. Casper Chamber of Commerce had a State of the City. Dr. Griffin participated on the panel and talked about the district in general and also about the upgrades at Casper Elementary. Thank you to Addition Financial for their selection of a classroom to make over at Markham Woods Middle School. We look forward to seeing that transformation. And thank you to Michael Lawrence and his team. He never says no, and we all come up with these things that we think he needs to send out and push out, and I appreciate you very, very much. We all appreciate the good work you do. And with that, we'll call this meeting to adjournment. Thank you very much.
Thank you.
It's not me.